Hello everyone, welcome back to my channel. This is Li, a pathology at Geisenberg Medical Center. Today, let's talk about bone and soft tissue tumor of the head and neck. With this entity to cover, I'm going to divide this lecture into two topics. This is the first one. The first entity, let's going to talk about Nasopharyngeal angiofibroma. So this is a benign tumor, usually with this fibroblastic tumor cell and richly vascular. So one clinical feature is that usually we can see this lesion in young men, peak age of second decade. And when we talk about angiofibroma, you must figure out, because we have at least four entities besides nasopharyngeal angiofibroma. We have the name of angiofibroma. The first one is fibrous papule. We usually use this term in the face and nose in the dermatopathology term. And then the other one is angiofibroma of soft tissue. This kind of angiofibroma is kind of deeper soft tissue mass, characteristic by tons of vessel. Then the other one is cellular angiofibroma of the genital. Characteristic finding is the immunostaining that is CD34 positive and albumin lost. And then the last one is giant cell angiofibroma. This is one variant of the solitary fibrous tumor, which we will talk about later. So do not make you confused about angiofibroma. So in the gross image, we can see this polypoid lesion with this really whitish looking surface that is making of this spindle cell. And then we have a lot of blood vessel around. So in the characteristic feature, just bear in mind everything in this angiofibroma, nasopharyngeal angiofibroma should be bland looking. You can see tons of blood vessel with this spindle, bland looking endothelial cell, and then in the stroma you have this spindle cell, some stellate cell. They not look the same, but they are bland looking. So we have tons of blood vessel. You also can see this is the Stadthorn vessel. I will talk about Stadthorn vessel again. Just remember this shape. And then the bland looking endothelial cell, and then this stroma tumor cell is spindly, stellate, spindly looking, kind of hypocellular. You can find this sclerotic stroma as well. One characteristic IST finding is the beta-catenin positive stroma cell. If you still remember, this lesion usually in the male, so you can find antigen receptor positive. But remember, SMA, desmin, and CD34 negative. Let's see some virtual slide. So in low power, we can see this mass. Even in this scanning magnification, you can see tons of blood vessel. So you can think about this entity, angiofibroma. So you need to bear in mind that the vessel wall, you do not find any hyalinized blood vessel wall. The vessel wall is kind of cellular. And then between this vessel, we have this hypocellular area. You do not see tons of cell compared to other sarcoma. And then characteristic finding of this sclerotic stroma. And then look at this bland looking spindle cell. They are beta-catenin positive and CD34 negative. Some cells look the same. Some cells they have this stellate shape, different kind of shape. Not all the cell looks identical. See this stellate shape, but overall they are bland looking. So just two component vessel and this sclerotic stroma. One more entity, even in low power, tons of blood vessel. And between this vessel, we have this sclerotic stroma and this spindle cell. really all the area look like the same. This thin wall blood vessel is characteristic for nasopharyngeal angiofibroma. We'll talk about the differential when this lecture is going on. Another entity I'm going to talk about is the lobular capillary hemangioma, aka pyogenic granuloma. So I think the first name is better to characterize, make you remember this entity. So let's see the image. So this is the polypoid lesion. You always can see a lot of blood vessel inside. One characteristic feature is this large blood vessel and fitting by this small vessel and then forming this lobular structure. Large vessel, small feeding vessel forming this lobular structure. And then when you sometimes this lesion this tumor you can see is ulcerated surface. And then just want to show you this lobular structure, big vessel feeding by this small vessel forming this lobular structure, really characteristic. Big vessel, small vessel forming this lobular structure. And then in the stroma you can see different kind of mixed inflammatory cells. Show you again, big vessel, small feeding vessel forming this lobular structure. And then some inflammatory cell like lymphocytes, maybe plasma cell, eosinophil, neutrophil, but kind of mixed. Low power, we already know this polypoid lesion, and then lobular structure, big vessel, small feeding vessel forming this lobular structure. And then see virtual slide image, polypoid lesion, ectophytic growth, kind of color red. That means this epidermis kind of hugging this wall structure. And then really characteristic big vessel surrounded feeding by this small vessel forming this lobular structure. And then you can see different kind of inflammatory cell, lymphocytes, maybe some plasma cell and neutrophil, but you won't see one population. One entity you always need to bear in your mind that is, if you find this lobular structure and then everything fits for pyogenic granuloma or this lobular capillary hemangioma, but you find tons of neutrophil around, one diagnosis you need to pay attention is bacillary angiomatosis, which is an infectious disease by Pathology-Li. Usually you can see it in HIV or other kind of immunosuppression patient. So one feature in the clinic that is pyogenic granuloma, you usually just see this single lesion. If bacillary angiomatosis, you will see multiple lesions. Another pyogenic granuloma, the same thing, just ectophytic growth, color red, lobular structure, big vessel feeding by this small vessel around forming this lobular structure. So this pyogenic granuloma. The other entity we want to talk about is Glomangiopericytoma. I just highlight the feature is highlight blood vessel because really similar to the entity we already talked about, nasopharyngeal angiofibroma. But from the entity, you won't find this hyalinized vessel. And also another two differential need to bear in mind is glomus tumor and solitary fibrous tumor. We will talk about them later. So pseudostratification epithelium with this monotonous looking spindle or maybe oval shaped cell, different size of blood vessel. Sometimes you will see this grand zone. That means from the epithelial and stroma tumor cell, you will have some area without tumor cell. And extracellular red blood cell, this spindle cell forming kind of like vesicle structure. And then this is the characteristic hyalinized blood vessel wall. You won't see this vessel in nasopharyngeal angiofibroma, but sometimes you will see this vessel in solitary fibrous tumor. And then all of these monotonous cell hugging around the vessel kind of feature make you confused with glomus tumor. But one differential because of the location in the head and neck nasopharyngeal area, it is really rare to see glomus tumor. But IC staining can help you do the differential diagnosis. Show you the vessel with this monotonous spindle, some oval looking cells, hyalinized blood vessel kind of characteristic, and then immunostaining SMA positive in this monotonous cell. Of course, glomus tumor, you will also find the same immunostaining, but beta-catenin both cytoplasmic and nucleus, more importantly nucleus, because almost all the cells will have cytoplasmic beta-catenin positive. But if you find nuclear staining, we call this is the true positive beta-catenin. So far we already talked about two entities with beta-catenin positive. That is this one, Glomangiopericytoma. The other one is Nasopharyngeal Angiofibroma. We already talked about the differential diagnosis. Solitary fibrous tumor, statistics, we will talk about this entity. For the glomus tumor, we also can see this monotonous cell hugging around the vessel, but like mentioned here, extremely rare in the sinonasal area, and then also only SMA positive but negative for beta-catenin. So this Glomangiopericytoma, let's see some characteristic finding. We have some edematous area, some hypercellular area, really bloody. And then let's see the characteristic vessel. This hyalinized blood vessel wall. See, hyalinized blood vessel wall, not like angiofibroma. Kind of hyalinized blood vessel wall hugging by this monotonous cell. These cells sometimes they can form this whirling structure. Really bloody, they look really identical. Remember the characteristic immunostaining SMA positive and beta-catenin positive. Another area also the same, hyalinized blood vessel hugging by this monotonous cell. Sometimes the cell can form in this whirling structure. Another one, even in this power, we can see tons of blood vessel, but when we zoom in, we can see kind of characteristic hyalinized vessel wall hugging by these monotonous cells. So for me, really identical to the glomus tumor. You really need the immunostaining to just help you make the final diagnosis. Glomangiopericytoma. The next entity is solitary fibrous tumor. I already highlighted the characteristic finding. One is the Stanhorn vessel. This is the Stanhorn. So the vessel just mimic this shape. And then haphazard growth of the spindle cell. This kind of spindle cell is monotonous because in the soft tissue world, when you have any kind of transfusion, not because of this transfusion, whatever transfusion you can find in the soft tissue tumor, the tumor cell look identical. So for SFT, the characteristic finding is NAB2 STAT6 transfusion. And then haphazard growth, another name is patternless pattern. That means this spindle monotonous cell, they just grow like different angle, different they do not form any recognized structure, not vesicle, not herringbone, not anything like this. So this is the Stanhorn vessel, and then all the monotonous spindle cells, Stanhorn vessel. Sometimes you also can see this hyalinized vessel wall, just mimicking the Glomangiopericytoma. So Stanhorn vessel monotonous spindle cell forming this haphazard growth patternless pattern. They may have some sclerotic stroma. This is epithelioid variant of SFT. Usually they are spindle cell neoplasm, but they have a variant of epithelioid looking. This is a malignant form of SFT because SFT is a tumor. We're not sure about the behavior and the prognosis, but when the cell forming this hypercellular area, hyperchromatic mitosis, you may think about malignant SFT. Basically, we estimate from the size of the tumor, from necrosis, mitosis counting, some feature like it to make the malignant diagnosis. Characteristic finding is this STAT6 nuclear staining, and usually this tumor cell is negative for CK, SMA, desmin, and S100. So for the SFT, one helpful finding for a dermal mass that is whether it's benign or malignant, we can just divide it to two halves. Are they symmetric? Is this lesion well demarcated? If they are, really likely a benign lesion, but one exception is that metastasis. When you have metastasis thing into the dermis, they usually just like symmetric and then brown, well demarcated. So going back to this SFT, even in this low power, we can see some vessel, kind of Stathorn vessel, and then some area with edematous hypocellular, some areas hypercellular. We always can see this sclerotic stroma, and let's take a deeper look at this Stathorn vessel, and then between this vessel we can see this haphazard growth of monotonous tumor cell because of the transfusion. See, they just do not form any vesicle, any swelling, any herringbone. They just grow everywhere in different point of direction of these spindle cells. And then some edematous area is characteristic, and some sclerotic area. So this is SFT. So this is the conclusion of the first part of bone and soft tissue tumor in the ENT area.